Hey guys, I'm back with another live stream after I had dinner now, and let's begin to discuss about the intravenous injectable anesthetics, which we left on previous live stream. So often injectable drugs are used, okay, in combination with inhalant agents. These drugs tend to have synergistic effects. Mixing them can significantly reduce the dosage required for any individual drug. Okay. Injectable anesthetics are in general metabolized by the liver and excreted by kidney. So barbiturates, intravenous injectable anesthetics, barbiturate thiopentol. High lipid solubility, which promotes rapid entry into the brain, ultra short acting barbiturate, and results in a surgical anesthesia in one circulation time, less than 1 minute in less than one. eh? Okay. Hmm. Barbiturates can cause a circulatory depression, death from extreme hypotension in patients with hypovolemia or shock, and respiratory depression, apnea, coughing, chest wall spasm, laryngospasm, and bronchospasm. The latter is of particular concern for asthmatic patients. Bronchospasm. Okay. Thiopentol. These drugs are used for induction of a general anesthesia to induce unconsciousness smoothly or rapidly. For short surgical procedures or for use alone as intramuscular, intravenous, as rectal anesthesia. For maintenance of anesthesia in prolonged procedures administered as infusions. To produce hypnosis in large doses during balance anesthesia in combination with opioids and two. For sedation to produce a calming effect during short diagnostic procedures or regional anesthesia in adults. Okay. Thiamine is a drug for induction of general anesthesia to induce unconsciousness smoothly and rapidly. Okay. Okay. For short surgical procedures for use alone as intramuscular, intravenous, or as rectal anesthesia. For maintenance of anesthesia in prolonged procedures. Okay. Maintenance. Okay. It is used for induction as well as maintenance. ठीक है. Of general anesthesia. ठीक है. Unconsciousness smoothly and rapidly. For short surgical procedures for use alone as intramuscular, intravenous, as re- uh, rectal anesthesia. For maintenance of anesthesia in prolonged procedures administered as infusions to produce hypnosis in large doses during balanced anesthesia in combination with opioids and healing. For sedation to produce a calming effect during short diagnostic procedures or or regional anesthesia in adults. Okay, so barbiturates, fundamental treatment of convulsive states, narco analysis in psychiatric disorders. Yeah. Okay. Benzodiazepines, diazepam, lorazepam, and midazolam. Shorter acting, 2 to 4 hours, and more potent than diazepam. Replace the seen by increasing the activity of GABA. Okay. So the benzodiazepine effects sedation, anxiolysis, amnesia, and anticonvulsant. Benzodiazepine clinical uses pre-medication drug diazepam, Valium, uh, l- lorazepam, and midazolam facilitate amnesia. Anxiolysis is administered before patient entering the operating room as a pre-anesthetic medication. Midazolam is widely used during induction or adjunctly with inhaled anesthesia, is not used alone for the surgical anesthesia. for short diagnostic therapy or endoscopic procedures along or with scenes depressants. Benzodiazepine receptor antagonist, flumazenil, romazicon, accelerates recovery from benzodiazepines. Okay. Ketamine. This drug is non-narcotic, non-barbiturate anesthetic, which produces a state of a dissociative anesthesia or trance-like state, a sense of detachment from one's physical body and the external world, depersonalization and de-realization characterized by marked sedation, profound anesthesia does not feel pain, and amnesia. Heart function, breathing, and airway reflexes generally remain functional. Okay, so ketamine mechanism of action. It is an antagonist of NMDA receptor. It also acts on opioid receptor monoamine transferase transporter. Okay. So ketamine clinically used for one, uh, okay, NMDA antagonist. It also acts on the opioid receptor monoamine transporter. So ketamine clinically used for starting, inducing, and maintaining the general anesthesia as a sole anesthetic for minor surgical procedures. Ketamine is used mainly in incidental and elderly adults for short procedures as a bronchodilator in asthmatics or people with COPD. Okay, as a sedative and analgesic in emergency department for physically painful procedures to supplement spinal or epidural anesthesia during the low dosage. So what are the clinical uses of the ketamine? For starting, inducing and maintaining the general anesthesia. Okay, as a sole anesthetic for minor surgical procedures. Okay, as a bronchodilator in asthmatic or people with COPD. As a sedative and analgesic in emergency department for physically painful procedures and to supplement spinal or epidural anesthesia using low dose. Okay. Ketamine has a unique property. It is a cardiovascular stimulant. Okay. It is a cardiovascular stimulant. Unlike benzodiazepine, it it increases blood pressure and cardiac output. This property is especially beneficial in patients with either hypovolemic drug of choice for people in a traumatic shock who are at the risk of hypotension or cardiac shock. Okay, so ketamine is a drug. It is a drug of choice for the patient with the traumatic shock or cardiac shock. Ketamine is considered relatively safe because the protective airway reflexes are preserved. Therefore, it can be administered intramuscular or intravenously in emergency surgery in frequent involvement. Disadvantages. Ketamine is contraindicated in hypertensive or stroke patients because it increases the cerebral blood flow, induces post-operative reactions like disorientation, excitation, hallucination, nightmares, particularly in adults. Well, opioids. Opioids activate mu, kappa, gamma receptors for endogenous opioid peptides. The most commonly used opioids are fentanyl and its congeners, uh, so fentanyl and remifentanil, because they induce analgesia more rapidly than morphine does. Okay. So opioids they are used as a pre-medicated drugs before anesthesia and surgery. As an adjunct, morphine and fentanyl are used with nitrous oxide benzodiazepine in anesthesia regimens intraoperatively, especially in high-risk patients who might not survive a full general anesthetic. In higher doses, as a major component of the anesthetic protocol during high-risk cardiac surgery to minimize cardiovascular depression. Now, clinical use opioids are used for regional anesthesia may either administered either epidurally or intrathecally into the cerebral spinal fluid. Leptan neuroleptanesia is a state of analgesia and amnesia is produced when fentanyl is used with droperidol and nitrous oxide. Okay. Okay. Fentanyl with droperidol and nitrous oxide. Okay. Adverse effects. These drugs are respiratory depressants that may be reversed postoperatively by naloxone. Opioids can all cause muscle rigidity as well as a post anesthetic nausea and vomiting. Propofol, Diprivan. Propofol is an intravenous hmm, sedative hypnotic drug. It is a rapid active drug. Maximum effect takes about 2 minutes to occur. So, okay. Advantages. Propofol is widely used and has replaced thiopentol as the first choice for anesthesia induction and sedation because it produces a euphoric feeling in the patient, does not cause post anesthetic nausea and vomiting. Recovery is more rapid and clear-headed. The drug is commonly used in the induction excellent inductor of anesthesia or maintenance of anesthesia and as an as an anesthetic in outpatient surgery short short procedures for sedation with opioids and benzodiazepines. It is most often in combination. So, adverse effects of propofol. At the usual anesthetic doses, propofol produces dose-related depression of central ventilatory drive and transient apnea, stopping of breathing. Therefore, it should only be administered in a hospital setting where airway management, a supply of supplemental oxygen, artificial ventilation, and cardiovascular re- re- resus- resuscitation are available. Okay, so it can cause the depression of CNS and apnea. Propofol causes a marked hypotension, decrease in BP during induction of anesthesia through decreased peripheral arterial and venodilation. It may cause negative inotropic effect, cardiovascular depression. Propofol is prepared in a lipid emulsion, which if not handled using meticulous strict safety precautions, can be a medium for rapid bacterial growth, resulting in sepsis. Pain at the site of injection is the most common adverse effect of bolus administration. Okay. So, huh? We finished, guys. Finished. Okay. Ah, 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 ah. Okay, guys. So that's it for today. Okay, And guys. So that's it for today. Okay, And guys. So that's it for today. Okay, guys. So